Now we get to talk about acute gastric ulceration. So for the acute gastric ulcerations is we're talking about the pathogenesis. So when you're talking about the pathogenesis of a disease condition, you're basically trying to address, okay, what are the step-by-step to how this disease condition actually came to be, So for acute gastric ulceration, you said that it refers to the sudden development of mucosal defects in the stomach. Do you understand? So you're having wounds, literally you're having wounds in the stomach, okay? So it's associated with a lot of things, maybe side effects of some drugs, maybe due to some underlying illness, a lot of things. So what's the pathogenesis? Pathogenesis is like you are trying to address the step-by-step to how this issue came about. So sometimes there's imbalance between the aggressive factors and the factors that should have defended you. You understand? So aggressive factors could be that the gastric acid is getting too much, bile salt is getting too much, non-steroidal anti-inflammatory drugs, you are using them for a very long time, or blood supply to the stomach is being obstructed at one point or the other. So defensive factors is all those mucus bicarbonate layer, prostaglandins, mucosal blood flow. So you understand, once the aggressive factors are now outweighing the defensive factors, you have the issue coming up. So major causes could be due to stress related issues, traumas, burns, sepsis, shock, a lot of it. So NSAIDs and aspirin, so they usually cause reduced blood flow to the stomach, okay? So alcohol and smoking can cause epithelial injuries. Side effects of chemotherapies and radiation can also cause damage to the mucosa. Sometimes it's a blood supply that is actually reduced, okay? So cellular and molecular events is if the blood supply is reduced, it now leads to the cells they are dying off because the blood supply is not adequate again. So there could be loss of mucus bicarbonate barrier, alright, and inflammation can now go on. You're now having ulcers, okay, and the person is bleeding and also losing much more blood, okay? So the morphologies, that you see a lot of ulcers. Most of the times their size is less than 1 centimeters, okay? I see at the surface of the ulcer, I see necrotic debris, granular tissue beneath, and fibrosis can also be formed sometimes if it is actually chronic.